Reproductive anatomy, male repro. All right, so for male reproductive anatomy, there really isn't much that's high yield. The pathway of sperm during ejaculation we thought was like gonna be big, but it really isn't. Just remember seminiferous tubules, epididymis, vas efferens, ejaculatory ducts, urethra, then penis. But like they never really asked that ever. But if they do, it's an easy question. The one question I do remember them asking is something that was so weird. That's why I remember it. It was something that like a patient got a vasectomy. I don't remember where this question was. It could have been like from a random bank, but it was like a patient got a vasectomy and they wanted you to know that sperm are still viable like up to 3 months after vasectomy is done. So like the wife or someone got pregnant and he was asking why. And like that was the answer, because there's viable sperm still able to cross even after vasectomy, like up to 3 months after vasectomy. Next, they like to talk about the damage to the urethra. Make sure you understand the anterior urethral injury and posterior urethral injury, but overall it's a relatively lower yield. They'll talk about like the bulbomembranous junction a lot, and that's going to be the location in which you'll see majority of patients having like urethral damage or injury. And lastly is the autonomic nervous system. So the autonomic innervation of the male sexual response is really important because you have parasympathetic for an erection, then you have the sympathetic for emission, and then for expulsion, it's somatic. So there's 3 separate nervous systems that work together in order to create the whole entire male response to autonomic innervation, right? Now, erection's the most important out of all of these because it uses nitric oxide in order to vasodilate, leading to an increase in CGMP and smooth muscle relaxation. And so then that will be pro-erectile, right? That will lead to an erection because it allows for blood flow to flow in. Norepinephrine is going to be opposite. It's going to lead to smooth muscle contraction and vasoconstriction. And it's going to be anti-erectile, all right? And a question that they love to ask is PDE5 inhibitors like sildenafil. They all end in "fil." They lead to an overall decrease in CGMP breakdown, so an overall increase in CGMP, and we give it to patients who have erectile dysfunction. But there's a large contradiction for patients that are also taking nitrates, because nitrates have the same mechanism of action by increasing CGMP, so they can go into a severe hypotensive crisis when you're giving them together, so they're contraindicated. The last thing that they like to ask specifically is that within the prostatic plexus, there's like fascia, within like the fascia of the prostate, you're going to have like innervations of the corpus cavernosa, which is like what fills and it facilitates erections. And so as a result, if you have like a prostatectomy or any injury to the plexus, that prostate plexus, it can cause erectile dysfunction, which is a very odd thing, but it makes sense because the prostate's location, right? So if we have a prostatectomy and we injure that plexus by accident, it can lead to a failure to innervate the corpus cavernosum, which leads to the overall erectile erection, essentially. So if I damage that area, I can get erectile dysfunction, all right? The last thing is our seminiferous tubules. The seminiferous tubules are essentially the location in which our sperm mature. And the first type of sperm, which are located near the outside, are spermatogonia, all right? These are the germ cell pool, and they produce primary spermatocytes, but these are just our germ cells, okay? So they're like our stem cells. And what happens is that we have our Sertoli cells kind of blocking in the spermatogonia, okay? And the reason behind that is because we want to maintain a blood-testes barrier. The reason that we need a blood-testes barrier is because spermatogonia are essentially stem cells. So our immune system can respond and attack them, and then that would lead us to infertility, okay? So Sertoli cells act as a tight junction between adjacent Sertoli cells from the blood-testes barrier to form the blood-testes barrier, okay? But Sertoli cells also have a lot other functions that are important. They secrete inhibin B, and inhibin B is going to go and it's going to inhibit FSH up at the anterior pituitary, okay? And that's a very important function because that functions as our negative feedback loop. Next, it also secretes androgen binding protein to maintain local levels of testosterone, because testosterone is needed to nourish those sperm so that they can grow. Moving forward, it also produces MIF, Mullerian inhibitory factor, which we already discussed. So within utero, it's going to produce this, and it's going to lead to Mullerian regression, right? The ducts are going to regress, and then so Wilfian can come through via the Leydig cells. Lastly, Sertoli cells just support and nourish our spermatozoa, and they're temperature sensitive. So be aware and keen to the fact that they are temperature sensitive. So overall, understand the functions of Sertoli cells. It's very, very important that they love to ask questions on it. For Leydig cells, they're not as important because there's not that many functions, but they secrete testosterone in the presence of LH, and they're unaffected by temperature, is something that they really want you to know. This is going to activate our Wolffian ducts, right? Sertoli says sit down, Leydig says let's go. All right. So overall, Sertoli cells secrete inhibin B to cause a negative feedback loop on FSH and inhibit FSH secretion. It secretes androgen binding proteins to maintain local levels of testosterone for spermatic maturation. It produces malaria inhibitory factor, and it causes a tight junction, creates tight junctions to form the blood-testes barrier. It supports and nourishes developing sperm, and they are temperature sensitive. Okay. So overall, know those functions, and you're going to be good for male anatomy.